And next is about the changes which we can see in the respiratory system. So these all points are like, while reading you can understand very easy points. Everything is decreased, the functional ability is being decreased. So I think, and these questions are always expected. Changes, cardiovascular changes in aging. It always came as a 5 mark question, already came, as well as respiratory changes, respiratory system changes. Similarly, all system changes. So these are important topic, but very easy topics. So in respiratory system, the respiratory muscles get atrophy, so that it will become weakened, and the ability to expand is reduced. So it will lead to shortness of breath. And all these things will contribute to rigidity of the thoracic cage. So again, the expansion is being affected. So decreased gas exchange, diffusing capacity. Of course, if chest expansion is not commonly properly occurring, it can affect gas exchange. And the lung elasticity is being lost, even the vital capacity also reduced. Cough reflex is being gone, so coughing is not effective, as well as gag reflex is also decreased. So we can see an increased anterior posterior diameter. So when these function diminishes, the body will try to make up. So as a result of it, the anterior posterior diameter will be increased. So increased respiratory rate, but decreased lung expansion. So the diffusion will not happen as normal. So decreased diffusion capacity of the lung due to this. So decreased inspiratory as well as expiratory muscle strength, so that it will decrease the vital capacity. So inspiratory as well as expiratory muscle strength is decreased, and it will lead to decreased vital capacity. So message me, what is vital capacity? So there will be increased resistance in the airway. There will be dilation of the bronchioles and ducts. The number of cilia will be reduced, and the activity of cilia will be reduced, so that what will happen? Accumulation of what? The secretions will be there. So it will contribute to infections. As a result of aging, there will be decreased number of nerve endings in the larynx also. So decreased level of secretory IgA, immunoglobulin A, in nose as well as lungs. Normally it used to be, so it will reduce the reduce the viral entry. So here what happens, that viral entry is not been prevented by this absence of the immunoglobulin A. So what happens? Decreased ability to neutralize the virus. So the number of functional alveoli decreases. So functional alveoli will decrease, and the walls of the alveoli will become thin. The alveoli, whatever the alveoli is there, it will get enlarged, but the elasticity will lose. Clear. So the recoiling function is also lost. So there will be decreased elasticity of the lungs, maybe due to collagen accumulation or breakdown. So combined less functional alveoli with slightly thickened capillaries leads to decreased surface area available for O2 CO2 exchange. So we have already seen that the alveoli, less functional alveoli is become reduced, and the capillaries will become thickened. So total the surface area for diffusion is decreased. So thus oxygen supply is being diminished to the vital organs. Clear. So the respiratory muscle lose strength and endurance, and the pulmonary vasculature become less elastic. Pulmonary artery will become thickened and enlarged. So thus there will be increased pulmonary artery pressure. So pulmonary artery pressure is increasing because of the loss of elasticity as well as increased thickening of the arteries. So these are things you can see in respiratory system.